We had 3 existing legacy networks in the eastern, northern, and northwest parts of the state. And as of September of this year, we have coordinated care networks and launched in over 110 Virginia counties, bringing us to a little over 700 providers in the Unite Virginia network to date, with a really ambitious and we think attainable goal of launching robust networks in each county across the state by late 2021. But signing up for Unite Virginia is not just signing up to use a referral tool, because really we're talking about way more than referrals. We're really talking about connecting people to care. So our platform allows providers to send electronic referrals to easily connect clients to services outside of their organization and share client information to new providers while tracking a client's journey throughout the community. So to give you a sense of how this works, let's walk through an entire client journey from end to end. And hopefully this diagram will really help paint a picture of the referral process. So here on the left, we have Tom. Tom meets with his case manager, Sue, at a local DSS office. During their conversation, Sue quickly realizes that Tom has several previously unmet social needs that Sue's agency cannot provide assistance for. Since Sue's organization is on the Unite Virginia network, she can gain Tom's digital consent and quickly and efficiently send an electronic referral to all of Tom's needs. So for example, Sue could send a referral to the local food bank to get Tom emergency food. She could send a referral to a local health district to get his blood pressure checked twice a month. And she can also send a referral to a daycare provider so that Tom's child can be enrolled in a pre-K program. Each agency will receive those referral requests, can accept them, and connect with Tom to address those needs. Now, everyone, including Tom, can receive updates about those referrals as they are sent and accepted. And those services are also rendered. Everyone stays really informed and updated in real time on Tom's care journey throughout the community. I'm going to pause there really quickly and see, I don't think I see any questions in the chat, but any questions about that referral cycle or workflow? Great. Well, now we'll get to the juicy stuff, privacy and security. So Unite Us, the Unite Us platform is HIPAA compliant. We fully align with the strictest federal privacy regulations, 42 CFR Part 2 and FERPA. But really the way that we see it is that compliance with these regulations is the baseline, and we want to make it easier to connect people to the services that they need while protecting people's information beyond the bare minimum that the law requires. So there are a few core values that shape our privacy and security policies and practices. The first that you can see at the top of this slide is that we will never share our client's data with any other network organization without client consent. Our consent process is offered in over 50 languages and at a 5th grade reading level, and Taylor will give a little demonstration of what that looks like and where that lives in the platform. The second is that we protect clients' most sensitive information using functions like role-based access and specific viewing permissions, especially around more sensitive services like mental behavioral health, legal services, and services for victims of interpersonal violence. And we'll dig into that in just a minute on our next slide. And then the last is that we keep client data secure, and we take that very seriously. The point to walk away with from this slide is that really as a community, we believe we must be able to do both easily connect people to the help that they need and protect their information as if it were our own.
Hey, Haley, this is Jim.
Hi, Jim.
There was a question that came in on the chat, and I see Taylor has responded to that, but do you want to pause and kind of answer questions as you go, or would you rather come back to them at the end?
Yeah, no, that's great. And I can take a drink of water. Let's see.
Okay.
Taylor, do you mind addressing the question?
Absolutely. So the question was basically asking if providers, who are receiving and sending referrals have to be a member as well. And the answer to that is yes. In order to both send and receive electronic referrals, an organization would need to be a part of the Unite Virginia network. And we'll wrap up with some next steps about how, you make that happen for your organization. And then we also had a follow-up question. I'm curious to know how many providers are available in our particular area and whether private providers are being recruited, for example, private mental health or medical providers. So for any organizations, if you're curious about your specific service areas, we can definitely have a conversation with you to identify, because that's something that we go through with all of our providers who are onboarding and active in the network. We ask them that question of who are those key partners that you would like to see involved in this, as we know that many times you already have established workflows with them. So we can definitely have a conversation about that offline. And then as far as private providers, yes, we are working, especially in the mental health space, with our partnership with the Virginia Mental Health Access Program, otherwise known as VMAP. We have a lot of mental behavioral health providers across the state who are already participating in the network. So great questions.
And maybe if I could just follow up on that too, because folks should know that I'm new to this concept as well. I don't really have much experience with Unite Us or Unite Virginia, so I'm learning as well. But if let's say I'm a DSS worker and I have a customer in my office and the person needs daycare, and so is the concept that I would kind of send that request or that referral out to all the daycare providers that are signed up to Unite Virginia, or do I like maybe select a couple that are close to the person's home? Or can you elaborate on that a little bit more?
Yeah, good question. And Jim Taylor will definitely demonstrate what this looks like in the software. It's
Okay.
very intuitive when you see it, which is fantastic. But effectively, yes. So, we have a couple of different ways of populating resources. So in each geographical region, we have the opportunity to really kind of build a robust kind of repository of resources in each region and network of organizations that want to participate. So if childcare providers in your client's community have listed their programs and their resources, you have the ability to search geographically pertinent resources for your client. You could also search, you have the capacity to search providers across the state. But what's really great about the software is that it will narrow that down based on certain filters for the client. So maybe geographic pertinence isn't the biggest concern, but they have a child that has special needs and they want to filter for specialized, ADA accommodations or something like that. A client can really choose to kind of, a case manager working with a client can really choose to help a client navigate resources in a couple of different ways, because every provider is giving this information about their organization, really autonomously owning what their organization's profile looks like in the network and providing all those details that could really help establish sort of a baseline understanding of whether or not that resource would be a good fit for your client's needs.
Great, thanks.
Yeah, absolutely. And Taylor will demonstrate that in the software. It's one of my favorite features for sure.
Great.
Wonderful. All right. Well, we'll quickly look at sensitive viewing permissions before we jump into a software demo. So just want to mention this because I know that we do have some organizations that we would consider sensitive or sensitive service types in here. So just want to spend a moment on this to point out that Unite Us really provides heightened protection for organizations that provide sensitive services or work with sensitive populations, such as mental behavioral health, substance use, legal services. So when a referral is sent for a sensitive service type, that referral is only viewable to the sending and receiving organization. So I want to walk through again another quick workflow of how this might work in real time. So at the top here on the right, you can see Ruth, our client Ruth, is picking up a food box from John, who works at a local food bank. Ruth shares with John that she's seeking help to stop smoking. John, as a network partner, can send a secure referral for tobacco cessation to a substance use partner in Ruth's community. This referral is only visible to the local food bank and the substance use partner. However, once that referral is accepted by our substance use partner, the case with Ruth's supplemental treatment plans, outcomes, et cetera, is only visible to that substance use partner. So the food bank would have insight to see that that referral was sent, to know whether or not that substance use partner had the capacity to work with Ruth. But once that referral is accepted and it's a case on behalf of Ruth with that substance use partner, the food bank really loses visibility around supplemental outcomes. So let's say a few days later, a utility assistance provider in Ruth's community is connecting with Ruth and providing her resources around a utility assistance. The utility assistance partner will not see the existence of that substance use referral case or any related documentation to that referral episode in Ruth's client profile. So really, Unite Us is leading this industry approach that prioritizes client privacy while ensuring that organizations providing sensitive services can access and benefit from a coordinated care network to meet a client's needs. So I did see a question just come in. What will the cost be to partners for system licensing once the initial funding ceases? Good question, Courtney. And I think this really depends, and kind of is where we can have a one-on-one conversation about what your organization really looks like, where you're located, what services you're providing. I would just say that by and large, we have, of course, this very generous partnership with the state around statewide funding through CARES Act dollars that we hope to see continue into the future. But we do have braided funding streams and multiple revenue sources that will always and in perpetuity exist to provide free licenses for community-based organizations, nonprofits, any of those human and social and then healthcare safety net providers in our communities, as well as government agencies. So we will always, be able to provide a way for any organization that wants to meaningfully participate in the network to really be able to do that in spite of one particular funding stream and its sustainability. So kind of a big picture answer, but really, we want to make this network available free of cost to any organization that wants to participate. And so we are looking for multiple ways to be able to make that happen and continue in perpetuity. So we can definitely connect one-on-one about that too.
So, and Haley, just to reiterate, there is no cost for localities to join the network, and you don't see that changing in the future.
Yeah, that's correct, Jim. I think we've been doing this work across the country for a while now, since around 2016, and I think that the model that we've established to ensure that community-based organizations and our social and human and healthcare safety net providers are really kind of embedded and at the forefront of this work will, be able to kind of prove its worth and for sure continue with sustainable funding from a multitude of partners in our community in Virginia, which is exciting. So I see one more question came in. If the substance use partner is not able to accept the referral, would you then send a separate referral to a different substance use partner? Great question, Patrice. And Taylor can demonstrate what this looks like in the software for an organization to be able to reject a referral. So let's say a referral comes into a substance use partner and for whatever reason, they're unable to accept the referral. Maybe it was an inappropriate referral. They're not serving that client. Oh, Taylor just probably wrote a very eloquent response to you there. Yep.
My fingers can't keep up.
That's good. That's great. And yeah, so Patrice, effectively, you have a couple of options as an organization to be able to reject or recall a referral. And then that organization, the food bank in this scenario, would be alerted to that rejection and would be able to redirect that referral to a more appropriate organization in the community. Wonderful. Well, without further ado, why don't we go ahead, Taylor, and jump into the software. And then when we come back from our software demonstration, we'll talk about really next steps and some data exciting prospects there.
Great. Thank you, Haley.
Forgive the interruption. Before we get started, would you be willing to turn on your camera? We'd love to see you.
I don't know as if I have the option to, it's saying that I can only share my video when I'm done screen sharing. I apologize. I didn't realize it was off.
No problem. Thank you.
I'll turn it on as soon as I stop screen sharing. How about that?
Sounds great.
All right. Sorry about that. All right, so we will go ahead and jump into the demo, which is always the most sought after portion of these presentations, where you can get a little taste of what this looks like within a real life scenario. So before we do so, I want to start on our Unite Virginia homepage, and I'll ask if Haley can drop that link in the chat. This homepage has a lot of great information about some of our partners, different resources. However, I always like to start here because it's going to actually show where you can log in. So say you had a license today, since this is all web-based, you're able just to log in straight from this homepage. This is what the login page looks like. And you might be wondering, why am I showing you this? It's not that exciting. But I always want to point this out because we do have the ability for this chat bubble here. So when you come on as a partner, there are a tremendous amount of different resources that are available for training, ranging from self-paced courses, live webinars, one-on-one consults with our team. But then you always have this chat bubble to be able to connect directly to our support operations team. We always share that they are real, live human beings who are team members across the country. And the really great thing about them is that in addition to knowing this technology inside and out and being able to provide that support, they're also they're coming from a background in healthcare, social care. And so they have, that added understanding of some of the scenarios that you might be facing at your organization. So we will go ahead and jump into the demo environment here. I will preface by saying that this is all fake client data. So we're just using this as a demonstration. So this is the homepage here, and up in the top right-hand corner, you would see your name. Today, I'm impersonating Van, who is affiliated with the Community Solutions Center. And this is not, I had shared in the introduction that I formerly use this platform, and this is not something that you have to live in 24/7, because we do have the ability to enable email notifications coming to you anytime there's something that you need to take action on. And so here you can see the status bar here, and this is just giving you a quick snapshot of your organization is accepting referrals coming in for your programs, which you do have the option, to designate when you're signing up for the Unite Virginia network. You'll be able to see if you have any new referrals. Maybe you had to place a referral in review because you just need a little bit more information. And then when your organization says, yes, we can accept this referral, it's going to open up a case. So just a little insight into what this looks like when you receive a new referral. It's a lot like your email inbox would be. So you'd be able to see which organization sent it to you, the client's name, what type of service that they were looking for that your organization offers, and then the date received. So if I click into this, I'm able to right away get a quick demographic information along with contact information, which is always going to be helpful. And then we have a referral description here that allows for you to get a little bit more information about kind of what's going on with this individual, what resources are they truly seeking. And then, as Haley had mentioned earlier, an organization has the ability to take action on this referral in a number of different ways. So we won't go through all of them today, but you do have the ability to either accept and enroll in a specific program. If, the example of rejecting a referral here, if I click on this, it's going to ask why. And so these are all really important data points that we're gathering so that you not only have for your organization, but we can have those community level conversations as well about maybe where there's some gaps in service for different services that individuals are highly requesting within a specific community. So this is where you would have to answer, maybe the client isn't eligible for services, you don't have the capacity, maybe you were unable to contact the client. You can select any of those there. But what I want to walk through with you today is actually what it looks like to send off a referral to another service provider. So we are going to pretend that we have an individual by the name of Jack Carter, who is at the Community Solutions Center, and Jack is, seeking some employment resume-related services that we offer, and it happens to come up that he and his family are in need of emergency food assistance. So, unfortunately, that's not something that I'm able to provide at the Community Solutions Center, but I know that I'm tapped into this larger network, so I'd be able to log in and create a new referral. And so the first thing that we have to enter for any referral is the first name, the last name, and a date of birth. And the reason for this is because it's going to search all of our records to ensure that we aren't creating a potential duplicate. So here you can see there's a couple people that populate with similar names and date of births, but we're going to say that this is a new client. And so we would have to create a quick profile for this individual the first time. And you can see that there are a couple required fields here that are mainly basic demographic information. And so if we had that information, if the client was willing to share it, we could certainly include it here. If not, we can always leave it as undisclosed. And then, like any good contact card, there's going to be information about how to contact this individual. So we can add in an email address. We can also add in a telephone number. And then a couple other neat features here. If we have these different options enabled, you can actually directly message the individual from within the platform. And then the notification portion here allows the individual to be notified as to their referral status. And then scrolling down to the address type, we know that not every individual has or is willing to share a home address. So we have a couple different options here. And at a bare minimum, what we want to be able to enter is a state and a zip code, because that's going to help us locate resources nearest to that individual. We're going to go ahead and create this client. And then now we are at the point of being able to create that referral to send off to another provider. The first thing that we would do here is select what type of service is this individual looking for. So there's a lot of different options that we can choose from, but it's all for good reason, because it allows us to really drill down into what exactly that client is seeking. So here we might just start typing in food. A couple different options come up. We're going to say that we're looking for emergency food, and it's going to populate another drop down here. And this drop down is going to have all of those organizations providing emergency food and how far they're located away from that client's address. So if you're working with someone very closely, you refer to them all the time, you know their eligibility requirements, you can just simply select it from this list. But what we see folks doing more often than not is actually leveraging this browse map. And this just displays information in a little different way. So of course you have the map feature to see where the client's located, where these other resources are. As Haley was referencing early in her presentation, you also have the ability to filter. So maybe we want to search for a program that specializes in serving seniors, veterans and military families, the LGBTQ+ population. You'd be able to designate that here. The same thing goes for different accessibility requirements, as well as languages that the programs are offered in. And then my favorite personal feature is that you're actually able to start clicking in to any of these organizations and getting a little bit more information about them. So organization descriptions, their hours of operation, different locations, as well as their programs, and maybe what types of eligibility requirements that they have. This is really important when you start getting into, like the question about different private mental behavioral health providers, because under payment options, it's going to specify if they accept insurance, what types of insurance. And all of this information, as well as like those different filter features, are actually populated by this specific organization and updated on an ongoing basis. So we will say that the 540 food bank is going to be a good fit. So we'll add the recipient here. And then another thing that I want to point out is if at any time you are unable to find an organization that fits this client's eligibility requirements, their needs, or maybe you just simply don't know, you're short on time, you don't know who to send this to, there's always going to be an option, regardless of what service that you're looking for, called Unite Us East Network Hub. And the Network Hub is actually staffed by Unite Us team members who all come from a background in social work. And you can send them a referral just like you would any other provider within the network, and they will pick up from there. All the while, you will receive that closed loop feedback as to who was, who did the Network Hub support team connect with the individual that you're working with to get them the resources that they need. So this is a really great fail-safe that has been really, really successful, especially here in Virginia. And of course, it just logged me out. Sorry about that. Okay, so we're going to go back to this page. We're going to select food, and we are going to select the 540 food bank. Okay, so then the last component here is this platform is built to be trauma informed. So this referral description allows you to type in a little bit more information about what is going on with this individual, maybe some resources that they've tried in the past, anything that would be helpful for that recipient organization to receive. And then while it may not make sense for this referral, we do have the ability to attach documents. So any type of, we see this a lot with utility bill assistance, eviction notices, resumes, you can always attach a document to send off to that organization. And I'm going to go ahead and skip this section, and we're going to say everything looks good on this referral. But I did want to show you very quickly what the consent portion looks like. So again, Jack was a new individual that we were entering into the platform for the first time. So we do have to get his consent in order for his information to be shared with another network partner. And that is a one-time consent that only happens the first time. So there's a number of different ways that you can get the consent. You can do everything from a traditional signed paper form that's uploaded to on-screen consent. We can also send the request for signature by either text message or email directly to the numbers and email address that is associated with Jack's account. What we're seeing more often than not, it really is this on-screen consent by attestation. And so what this means is you as the provider who's working with this individual would read this statement, ask them these questions, and then if they consented to have their information shared within the network, you would actually sign here on behalf of yourself saying you had gone through this step with them. So I'll pause here to see if there are any. I don't see any questions in the chat, but if anyone has any, please feel free to enter them in. And so we are now in our dashboard, and you can see here that this referral that we just sent off to the 540 Food Bank on behalf of Jack Carter for emergency food, it is needing action because we just sent it at 11:30 a.m. Since this isn't a sensitive service type, food assistance, we have the ability to click in and you'll be able to see updates. If you need to add in additional notes to relay to that organization, you can do so here. And this will build out a referral timeline with all of the information and interactions that both organizations have with Jack. And of course, we would be able to get information about when this was accepted, if a case is opened, what was the outcome of that case, so on and so forth. And then finally, there's so many things that we could do during this demo, but one of the things that I did want to point out here is the My Network tab. So this My Network tab will be available to any organization who's participating, and it is going to show all of the organizations that are also a part of the Unite Virginia network. Again, this is just the demo network, so we don't have every organization built out here that's in the live site, but you'd be able to narrow down by different service types. Again, you'd have access to these filters. And a neat thing that is built into this side is if we select any organization here, we have the ability to share it. So maybe I want to text it to the individual, email it, print it for them. We have the ability to do that here with all of the information about who may be in contact with them shortly. So with that, that concludes our very speedy demo, but happy to field any questions and turn it back over to Haley.
Thank you, Taylor. I totally get the speedy fingers thing. So if questions pop up, we'll just keep going for the sake of time with the rest of our content, which is very short. We'll leave plenty of time for questions. So feel free to go ahead and type those in the chat. And if you do have any questions, we are happy to return to any portion of this to address them. Thank you. All right. So just want to quickly kind of do a little vision casting here and sort of where we're going next. Really, the community transformation work that's being led throughout Virginia is pretty amazing. And the referrals aren't the end point. They're really just the starting point. We know that. We really see this community level care coordination work happening in phases. So today the focus is on how do we get connected, people connected to services. But is a streamlined referral to a housing provider going to address the housing shortage? No, and we know that. So this is where we like to take it a step further. What's next for our work with communities is really the first end-to-end solution that not only coordinates care between all partners, but really provides a platform where funds can be distributed to your organization and you can bill for services that you deliver. So while we work towards that vision, we really want to support you and your partners to coordinate care for everyone that you serve. Really use the data that's available to you to tell your story to constituents, secure more funding and resources, and drive a conversation about creating more equitable service delivery models. So on the next slide, I just really want to encourage you that this is your story and we want to help you tell it. So when you use our coordinated care network, you and other partners on the network are really painting a real-time picture of the social needs and sometimes a lack of resources in the communities that you serve through activity in the network. You will have access to data to demonstrate your department's outcomes, drive community change. Really, the robust sets of data that generate through Unite Us will enable you to track your department's activity, measure your impact in the network and increase visibility to gaps in services, and then inform community reinvestment decisions to increase access to services for all. This level of insight really gives you powerful data to help inform policymakers and community leaders on how to build more equitable systems to deliver services across the board. For the sake of time today, we won't dive into really robust sets of data that you can access through our software and through our data insights platform, Tableau, which you would have access to as a network partner. But we would love to set up an opportunity to connect with you one-on-one if you're interested in learning a little bit more about these data points and data sets. I don't see any questions popping up in the chat about data and end-to-end solutions, so we'll quickly jump into our implementation approach. So this is really kind of an example timeline to talk about our end of the year timeline for this initiative. So really, what's our approach to getting organizations onboarded and live in the network? First thing we do is we start with information meetings scheduled with your operational project leads. So these kickoff informations are really similar to a session that we're doing today, a large group session that kind of has a Unite Virginia overview, a software demonstration like you just saw from Taylor, time for question and answers, and then really specific next steps that pertain to implementation. After that engagement session, we have these one-on-one workflow planning meetings that will be scheduled for team leads and points of contact. So these are typically working meetings to discuss detailed plans for utilizing Unite Us, including current referral workflows that you might have embedded at your organization and tools that local staff use to coordinate care. We'll also review the Unite Us registration form, which we can talk about in just a second, and really kind of helps inform that contact and organizational card that pops up in the software when you're looking for resources for a client. So we, during these one-on-one workflow conversations, will review this registration form and then give you time to kind of process this partner registration. It's really effectively an online intake form, and Taylor might be able to pop the, or I might be able to pop the link into the chat so that you can take a peek at what this registration form looks like. It's effectively an online registration tool that allows you to kind of think through how your organization, your programs, and your staff and team might engage with the software, what programs you would like to be listed, what user roles you want configured on behalf of your staff in the network, and really kind of allows us to configure your organization in a way that's appropriate for your organization to participate in the network. After you submit your partner registration form before your team goes live, we will offer training. So I'm sure you all feel very equipped after seeing Taylor's speedy demo today to get in there and start using the platform. We kid, there is so much to dig into there. We really offer very robust software training for new users in the platform. So we do have really fantastic virtual training opportunities for new users to really learn about the technology and how to begin using the software prior to the activation of their licenses. So we offer live webinars multiple times a week around software training that are typically an hour and an hour to an hour and a half. We also offer pre-recorded self-paced trainings that a new user could walk through at their own pace before going live in the network. And then our team in engagement is always here to provide one-on-one support for training for new users in the network as well. And then you go live. So effectively, when we say go live, we mean that your users are licensed and they'll gain access to the Unite system to begin sending and receiving referrals. So the dates that you can see on this slide are really very hypothetical, with the understanding that as the holidays approach, we like to kind of get folks in and utilizing before we all adjourn for the holiday season. But that's effectively kind of an example of what the timeline would look like. Any questions about implementation or next steps? We hopefully like to keep a pretty low barrier to participation. Keep it easy.
Haley, I do see a question about interfacing with VACMS, which is what VDSS uses for their information system.
Yeah, gotcha. Okay, does this interface with me? And can it be integrated? So, Anita, that's a great question. We are actively in conversation, and how much configuration goes on at a local level. So we're actively in conversation. VDSS is, of course, a strong partner in this work. And so our implementation team manager, Francis, who may have engaged with many of you on this call already, is actively working to discuss what interfacing or parallel workflows might look like at a local level. I will say that, we're trying to keep this process as easy as possible for organizations to participate. And so we're trying to do a lot of legwork with standardizing programs. But really, once an organization is in the network, you have the capacity to configure programs, hours of operation, staff that can participate on the platform really autonomously. So it's a very iterative process. And if you decide that, you need to be more interfacing with other systems, we can help develop workflows that are parallel there and can also help configure a more localized approach to your participation in the platform. We can connect, Anita. If you have any other questions about that, we can really dig in there. And then I see another question about how do we interface and migration with PeerPlace. So great question. All of these questions about integration and interfacing are really great. What I will say is that integration is a really challenging and maybe not always the gold standard that we're looking at when thinking about participating with other pre-existing systems for care coordination. And I say that understanding that we are all using some type of system to help track clients, client care coordination in the community in some regard. But effectively what we're doing is taking this approach across the board. There are so many technical components to interfacing or integrating with other software systems. And really kind of our approach as an organization is to really look at how your organization is utilizing other software tools and how we can help augment that work that you're already doing in PeerPlace or VACMS with the Unite Virginia and closed loop electronic referral platform. So we can get you more specifics specifically around conversations with VACMS and PeerPlace. But at this point, our only built-in technical integrations are really working with electronic medical and health records at the moment. And then Anita says, as a local Department of Human Services, we use 40 different data systems. Yes, due to all of the state and federal systems, as well as local ones. Yep, Anita, we hear you. We totally understand. And just want to throw out there that, this tool might not be the most effective for your organization. You might, have it all figured out with your systems that you're currently utilizing. Where we want to be helpful is, to just provide this extra tool in your toolbox if it's effective for your organization, and really be able to kind of offer this as an augmented resource. But it might not make sense. And maybe this is a resource that then, Anita, you can pass on to other organizations in your community that might be a better fit for the tool. Absolutely.
Okay, and so thanks so much for going through the slides and doing the demo. I think that was great. I did have a question in terms of outcomes, and I think it's terrific that you might be able to get a sense of what happens to the referral after you make it. In the case of Jack, where we referred him to looked like a food bank, um, do we get an email back when something actually happens, or would we have to go back into the system and kind of search for that and find it?
Yeah, great question. So in that scenario, you would actually, if you had the ability to, or if you had it turned on that you would receive emails for any time something was updated, you would actually receive an email saying that, the referral had been accepted, and that would prompt you to log into the platform to get those additional details. So it is something that if you want all of those notifications, we will certainly provide you with them.
That's great. Okay. Well, I think we do have a few minutes for some other questions if anybody has them. And I see you are providing also in the chat a link to the partner registration form. That's where someone would go to get started if they wanted to find out more.
Yes, absolutely. And Jim, you posted our contact information earlier, but maybe Taylor can pop our email addresses in there one more time. And we are happy to provide the slides from today's presentation. So if we wanted to follow up with those, everybody is welcome to those slides. And then, a great next step, I would say, for these one-on-one conversations to really dig into whether or not this would be a good fit for your organization is to reach out to Taylor or myself by email directly, and we can set up a time to connect and really, answer any of those follow-up questions that you might have about your organization specifically. We also have statewide information sessions. So it may be redundant for you all on the call today to join one of those information sessions. And now that we can see Taylor, I can see that she's going to look for that link for you all now. But it's a great resource to pass on to referral partners or other organizations in your community that you think might be interested in learning about this tool. It'll be very similar to what we covered today with more broad information about Unite Virginia, a longer look at our software demonstration, and some information about registering your organization in the network.
Absolutely. And I just dropped that link in for upcoming events for the Unite Virginia network in the chat. And the one thing I'll add is that Haley and I are constantly brainstorming with organizations who maybe want to troubleshoot a specific inefficiency that they have, or maybe bring partners on board to streamline for grant reporting purposes. So we love to have those conversations. So don't be shy about reaching out to us one-on-one if you just want to have a very high-level discovery call that we can really start digging into the details.
Great. Okay. And I think you said that there are kind of regional managers, like Haley, are you in the central region, and Taylor, are you in the eastern? Or did I get that right?
Oop, yep, you got it right, Jim.
Okay. So if I'm in Northern Virginia, then you probably would refer me to one of your peers up there.
Yep, absolutely. And, Taylor and I are happy to stay in. We really take a statewide approach to engagement. We are all in this collectively as a team to build resources across the Commonwealth. So if you have any questions, or if you are outside of the central or eastern region of the state, feel free to email myself or Taylor, and we can get you connected to your regional engagement manager to provide just a little more of that regional context for your network.
Yeah, and just for everyone's knowledge, we have someone based in Northern Virginia, Richmond, Roanoke, Charlottesville, and myself in Norfolk. So pretty good coverage.
Got it covered. Yeah, great. Okay. Well, I don't see any other questions coming into the chat, and so and I think we're just perfect on time. And you all are to be commended. I think you did a great job of partnering to monitor the chat and answer questions along the way. So, so great job with that. On behalf of VALHSO, we just really appreciate your time today to show us more about the system, and I bet that there's going to be some folks who are interested in following up with you later on. And so with that, I think I'll turn it back over to Nancy for what's next on the agenda. Thank you.
Yeah,
Great. Thank you all. Yes, I echo Jim's sentiments. It was really great, useful information that we can really do something with. So I appreciate the time that you spent with us today. And I do want to take a noon break for everybody to get some lunch, and invite everybody to join us back at 1 o'clock, where we'll have the session on the implications of Virginia's marijuana legalization. So that promises to be another really informative session. So I will thank you to Haley and Taylor again, and Jim, and we will hopefully see you all back at noon.